Assalamualaikum doctors. In this video I am discussing how can we take the leukemia history. So leukemia history also comes, it is an exam scenario. The task was is that take history from a mother who's 6 years old, had about 3 weeks history of lethargy, looking a bit pale and reduced appetite, then developed some non-blanching spots or bruising 3 days ago. So that is the non-blanching rash, 3 weeks fever, history, the child is pale, that is anemic, reduced appetite, everything is going supporting one of the DD is leukemia. We know the DD of fever with non-blanchable rash DD, we can keep leukemia, ITP, Hennescolin purpura, meningococcemia, COVID, PIMS, pediatric inflammatory multisystem syndrome, and immunodeficiency. Let's see how can we take. So first we are analyzing the chief complaints, histopresent illness. Did they all come together, the fever and the rash? About the fever, we are analyzing onset, course and duration. Is there any diurnal variations? Measurement method. Medications given. Any rigor, night sweating or abnormal movement. Now rash, about the onset, course and duration. Describe the rash. Distribution. Is it elevated? Is it itchy? Does it disappear when you press on it? Is it preceded by any runny nose or flu? Weight loss. About the appetite loss, losses like vomiting or loose motion. Evidence. How did you know from his clothes become looser or you know his measures? Do you have his red book with you? So weight loss, we ask that the child has any appetite loss occur. The reasons of weight loss we search like vomiting, loose motions, any evidence present like weight taken or the red book with you, growth chart. These are. Then about the pallor, we know hookup. Easy to remember. Hookup means the child become hemodynamically stable or not. Is there any fainting or awareness of the heartbeat? Then bleeding from any body orifices, and if present, ask about the color of the patient and pee and poo and the amount. Then other concerns like any dysmorphic features, long-term health conditions. Review the system. Systemic review one by one. We are going first of all hematology, any blood or bleeding, recurrent bugs and bruises. GI about the tummy size, pain, poo, vomiting, pallor or yellowish discoloration of a whitish part of the eye. Nutrition very important in details. What about his measures and growth chart? Sometimes MSK about the muscle pain, skin lumps, neck swelling, like size, mobile, red, hot, painful. So any lumps very important. We know lymphadenopathy presents features of leukemia. Hair, nail, lip swelling, bone pain, joint swelling. General FWSL like fever, weight, activity, sleep, appetite, weight, activity, sleep. Then about the CNS, was vision affected, unilateral or bilateral? Is there any redness of eye, hearing, fears, bug in brain, decrease the consciousness level, increase ICT signs, abnormal movements and weakness. Chest about recurrent bug, cough, dyspnea, musical sounds, contact with COVID. CVS about the heart racing, exercise intolerance, awareness of heartbeat. Urinary about the pee, change in color, odor, burning sensation. Anyone measures his RBS, anyone measure his blood pressures, any enlargement in the testicular size. Remember leukemia, there is private part is enlarged, so if boy, we ask that enlargement in the testicular size. Then past history is important. 5T IOA, that is recent travel, trauma to his tummy, exposure to radiation, history of any blood transfusions, any medications he is using, any illegal drugs. Perinatal history, the period before pregnancy, during labor and after that. Do you have any puberty according to the age? Vaccination, did he receive all his shots? Any abnormal reaction to vaccination? Any extra shots as BCG site? Allergy, certain type of food or allergies. Development in detail if less than 2 years. Family history of similar conditions. Then psychological or impact. How does his condition affect the family? School, type of the school, performance and attendance and bullying. So this is how we take, and the DD I already tell that we can keep leukemia as 3 weeks duration. So first leukemia come. ITP and acute infections, and in ITP we know that features the child is active, there is bruises on different sides and bleeding, thrombocytopenia, so petici purpura, but it is not like pale or long time repeated fever like that. Hennescolin purpura, we know that lots of features, plus especially the distribution of the rashes are in the buttock, lower leg disease, and also HSP, there is arthritis, there can be hematesis, abdominal pain, bleeding. This is the Hennescolin purpura. Meningococcemia, the child will be toxic. There will be high grade fever, neck stiffness, meningitis features, abnormal movement, and also the rashes. COVID, we know that pediatric inflammatory multisystem syndrome, lots of features and immunodeficiencies, repeated infections. So these are the DD of leukemia history. Thank you.